Hi, this is Mike Berkeley, licensed acupuncturist and board-certified herbalist, speaking to you from the Berkeley Center for Reproductive Wellness here in New York City, Monday evening at about 9:30 p.m. I'm speaking tonight on endometriosis and its relationship to infertility. The question is, why does endometriosis contribute to infertility? Well, there are a couple of reasons. One that's the most obvious and one that's a little more interesting and not so obvious. First of all, let's really define what endometriosis is. Endometriosis means that there is ectopic deposition of endometrial tissue. That means that there are endometrial cells that belong in the uterus and other parts of the body. These cells can be found in the nose, in the large intestine, in the area between the posterior aspect of the uterus and the anterior prospect of the rectum, called the cul-de-sac. It can be located in the lungs, many different places, on the ovaries, on the tubes, in the tubes. One of the most obvious means by which endometriosis contributes to infertility is by the adherence of adhesions on the fallopian tubes. So what this means is that since the tubes are not patent or functioning properly, it's very difficult or impossible for an egg to get fertilized in the fallopian tube. Of course, what may happen is an egg can get fertilized in the fallopian tube and actually implant there, resulting in an ectopic pregnancy. So this is why endometriosis can prevent one from conceiving anatomically. But what about the patient who has endometriosis where there is no pelvic distortion that would interfere with fertility? For example, the tubes are fine and the ovaries are fine. Why is it in that case the patient may have difficulty conceiving, even if she's a younger patient with a normal hormonal profile? Well, the reason is because endometriosis is what's known as a pro-inflammatory cytokine disorder. Essentially, it means it's an inflammatory disorder. And even if the tubes are functioning and the ovaries are functioning and there are no adhesions as a result of the endometriosis, these inflammatory cytokines, these inflammatory chemicals actually circulate in the uterus, destroying or attacking an embryo that's trying to implant. And so therefore, you have an embryo that's in an environment that's overly heated. So it's kind of like putting a bun in an oven where the temperature is turned up very high. That's going to burn the bun. And so fertility is not likely to happen in the endometriosis patient, even in the absence of anatomic abnormalities that would prevent fertility from occurring. So how do I recommend addressing this issue? Well, my philosophy as a practitioner of Chinese medicine and one who's been practicing in the area of fertility care for 13 years is to include both traditional Chinese medicine, which is to say acupuncture and herbal medicine, with conventional Western medicine. Western medicine should be used from the perspective of a laparoscopic procedure, whereupon the endometriosis can be eradicated from the pelvic environment, thereby greatly reducing the inflammatory processes that occur as a result of endometriosis. The problem, however, with many laparoscopic procedures is that in many cases, not all of the endometriosis can be lysed or cauterized or resected. And so what happens is you may have a patient who still has difficulty conceiving even after a laparoscopic procedure is done. This is where herbs and acupuncture can be of utility for this type of patient. Herbs and acupuncture, when used in the hands of a specialist and of an expert in the area of infertility, can help to reduce the inflammatory process caused by endometriosis, and so thereby creating a uterine environment that's much more, how can I put it, amenable to an implanting embryo and to an ongoing pregnancy. So the message that I want to impart this evening is that the best case scenario for the treatment of endometriosis, as well as other disorders that contribute to infertility, is really the joining of Eastern medicine and Western medicine, or as I like to say, the East meets West approach to fertility care and well-being. Hopefully you've enjoyed this mini lecture on endometriosis and Chinese medicine and found it interesting. I look forward to speaking with you again soon on another topic of interest, and thank you once again so much for listening. All the best. Have a good evening. Good night.